You're looking worse.
Thank you.
Hey, no problem. I'll go ahead and call the meeting to order and start the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Well, good morning.
Good morning.
And next on the agenda is approval of the agenda.
I will move to approve the agenda.
Second.
It's been moved and seconded. Any discussion? Hearing none, all in favor say aye.
Aye.
Aye. Motion carries. Next is approval of the minutes.
I'll make a motion to approve minutes.
And I'll second.
It's been moved and seconded. Any discussion? Hearing none, all in favor say aye.
Aye.
Aye. Motion carries. Next is approval of claims for payment.
And I will move to approve the claims for payment.
Second.
It's been moved and seconded. Any discussion? Hearing none, all in favor say aye.
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 Motion carries. Next we have is Hanson Family Hospital update.
Hi, good morning, everybody. We were just sitting here before the meeting started thinking 4 years ago we were doing the 3P event in Eldora and talking about all the steps it took us to have the hospital, and of course it would have been possible without everybody's help. So we want to give an update. Michael White's going to start and give a quick overview of where we are financially, and then Shane and I will talk you through some operational successes that we've had. So thank you.
I want to just start out with kind of giving you an update of where we are year to date in relation to the bond covenants and just in general how we're doing financially. You may have seen this already in the board minutes, but for the hospital. But year to date, we currently have a net income. This is through December of $324,985. So, considering that we're in a brand new facility with a lot of additional expenses related to depreciation and interest, we're doing fine financially. And related to that are the financial ratios that we have to maintain for the bond covenants or else we'd be considered a default. There are two financial ratios that we have to exceed. The first one is days cash on hand. The bond covenants require 60 days of cash. We currently have 68, as of the end of December, 68 days of unrestricted cash. But if you include all of our cash, which includes finances available for capital purchases and things like that, we have 150 days of cash. So we are well above the minimum needed for the bonds. The other ratio that we must maintain is our debt service coverage ratio. And basically this measures our ability to cover the bond payment, our mortgage. We have to generate enough cash in a month to cover more than 1.25 times the bond payment for the month. And for the month of December, our debt service coverage ratio was 2.21, so that is well in excess of what we are needed to comply. Now going back a little bit, if you wanted to look at our audited financials, which we had just received, for fiscal year 2013, just as a little history, we had a net income of $551,826. And then for fiscal year 2014, which ended June 30th, we had a net income of $133,345. If you were to actually look at our audited financials, you'll see a big loss there, not those numbers. What that is, and I mentioned this before, I think a year ago, is that we had to accelerate the depreciation on the old facility. They call that an impairment loss, and there's still book value, or there was still book value in the old facility, and because we knew when we were going to end being in there, we had to accelerate that depreciation over that time period. And the total amount was about $3 million, and it happened to fall evenly into 2 fiscal years. So there was approximately a $1.5 million loss or impairment, accelerated depreciation in 2013, and 2014. So if you were to look at the audited financials itself, you would see that loss. Now, it's not a cash loss. It didn't affect the ratios. In fact, for the audited financials for 2014, we had 71 days of cash on hand, and our debt service coverage ratio at that point was 3.8. So we well exceeded the amount that we needed. And then just as another update, more related onto ongoing finances, one of the things that we've seen happening just in the last few months is our charity care has significantly dropped. And we can attribute that to the Affordable Care Act, and especially the expansion of Medicaid. We are now able to, for most patients, if they are unable to pay, and based on their income, we can sign them up immediately for Medicaid. They call it presumptive eligibility, and we can do that ourselves, and it covers them immediately for that stay. And that has dramatically dropped our charity care in the last 3 months. We used to average $30,000 a month, and for the November and December, the total for those 2 months was about $10,000. And right now, for the month of January, we don't have any. So those are positive financial things that are happening and should be going forward, assuming the Affordable Care Act and the Medicaid expansion continues. Does anyone have any questions?
Thanks, Mike.
Sounds good.
Just a couple other things that I think we've been really successful at. We've been growing our specialty care programs. That has been going very, very well for us. 4 years ago, we were having an extremely difficult time recruiting physicians. I'm happy to say that we've filled all our positions. We have one opening for an MD at Ackley, and right now, honestly, we have 3 to 4 candidates wanting to come in this month for 2 years out and have other people calling us. So we're no longer begging and pleading and calling everybody. We know our phone is ringing and people want to come in to see the hospital. I think the building is beautiful, but I think our culture and our patient satisfaction scores have changed. So it's a great place for people to want to work. Emergency services, probably 18 months to 2 years ago, we didn't have enough physicians, quite frankly, to take care of our emergency services area, so we had to do what a lot of hospitals do. You contract out to have somebody come in, and of course that's not ideal because it's not somebody who's working with you on an ongoing basis. We are just about done. We've hired our own emergency staff. We just signed one more physician who will be starting for us later in the month. Will be full-time in emergency services. And so all of that is coming together very nice for us. We're really happy about that. Finding providers for rural healthcare right now in most places is very difficult. So thank you for all your help and support. We have one big hurdle we need to get over, and then we're gonna get to actually be a hospital that can just do day-to-day operations. We're getting ready to launch the electronic medical record. That's inpatient and outpatient. We're on a product called Community Works, which is designed for critical access hospitals. So really all the paper charts, for the most part, for our applications will go away. Less of a change for our inpatient facility because we've been on electronic medical record, but all of our clinics, this is brand new. So there's quite the learning curve, and our go live date right now is tentatively set for May 4th. So the nice thing for patients is we'll have one portal, but more importantly, all the paper that we have to hand to patients will go away. We'll have electronic signature, so we're really excited, and more importantly on the patient safety side, you know, we're able to pull reports that tell us how we're doing in various categories from a quality and patient safety perspective, which is great. And then last but not least, we've started, if you've heard about population health, accountable care, taking the politics aside from all that, what it means for us is we've hired health coaches and what's called patient navigators, so we can work with those populations that are more at risk or tending to come in for a lot of repetitive services, so that we can help manage their medications, make sure they're getting to appointments, educate themselves or the family, to make sure everything is going well. So just a brief example, if I'm in the hospital and I get discharged, a nurse is going to meet with me right upon discharge to make sure I understood my medications, to make sure I'm not gaining in fluid. They're going to get me to a doctor within 7 days to follow up, and then we'll see a nurse in between. The goal is to keep me from going back into the hospital for that same episode, and that's a good thing for the patient and the family. Nobody likes to be in the hospital, and it's a good thing for employers. So we're kind of moving right along with everybody else, and I think doing a good job of making the changes that we need to make and kind of right-siding in the building. Building issues, I think, are right where we need to be. You kind of continually adjust in a new building for about a year till you kind of hit each season and see what's happening. So, you know, we're learning all about winter in the new site and what that looks like and what works well and what kinds of things we need to work on. So, Shannon, anything you have?
I think just to echo the population health piece, and our role as a hospital is definitely changing from not just being there when you know, critical illness happens or injuries or things like that, but to be the healthcare leader in our community. And so we're looking more for those opportunities to make sure people know that we have programs and education and help them get in for preventive medicine and screenings for early detection and help catch diseases and injuries before they happen, or at least early, so that there are better outcomes and lower costs for everybody all around. So that is our focus as well.
Thank you.
Thank you. Anybody have any questions?
No, thanks.
Yeah, thank you.
Anybody else have any questions? Well, thanks. I'll go to the next one, which is Cindy Litweiler on a fund request.
So, as you know, we have been working on our rail site that is west of Iowa Falls. This is we were one of the first 4 communities that achieved site certification status through the state certification program. And this is in regards to constructing a connecting track between the UP and the CN main lines with a manifest yard and a possible transload facility. Through all of this, we have taken the design of that rail through to the 30% design, and now we have a contract in place for the final design. A couple years ago, I had applied through Iowa Department of Transportation and on behalf of the city, and we received a grant and a loan from the state. It was $300,000 grant and $600,000 loan, and that was based upon 50 employees coming into that park. The contract that we received from Via Rail Logistics is for $79,600. This is for the final design of that whole complex. I have checked with IDOT, and the grant money is available with a 50-50 match. So the board and I are trying to figure out how can we fund this. And our agencies are very cash constrained. So we felt if we could access the IDOT loan and utilize the lost funding that had been approved by the county voters last November, this would pay for that final design. In an effort to try to not access the entire 50% of that amount, we felt if we could get a revolving loan fund approved through the Iowa Falls Revolving Loan Committee, we could stagger that over 5 years if the county would be willing to utilize that lost funding to help us pay back that loan. IFADC is willing to pick up the cost of any interest that's accrued. Normally the city and the revolving loan committee charge a 3% interest. So we would be willing to do that out of our hotel motel allotment. So basically we're coming to the county to see if they are interested in helping us in this specific project through their lost funding.
I think it's a great project. We've been working on it for 3 years or
Well, ever
2 and
since
a
I've been
half.
here, which is almost 4 years.
Almost 4.
We have some significant proposals out in response to RFPs for companies looking at a location, so even if one of those come to fruition, you would be looking at some significant job growth and some capital investment that would increase our tax base here.
How many people did you tell us?
Right now, I've got 4 proposals out. You'd be looking at over 650 jobs. Like anything with marketing, you start with a wide funnel and then you narrow down as companies either drop off or they continue to move forward. Even the lowest one was 50 jobs, and then it went up to 150, and the largest one was 340 jobs. So, and these have come through the state leads and also through a site selection firm. So it's companies that are definitely checking out all options. So we want to make sure that we are as far along in the process as we can be, and saying, we've done a lot of heavy lifting up front, and hopefully you'll take a look at us.
Any comments?
So you're requesting 40,000 from the county?
39.6.
Mhm.
39,600.
Okay,
Payable over 5 years.
5
is
years.
what
Mhm.
we had thought.
All right. I know I had this written down somewhere else.
Okay.
Okay.
And we met on this last week where you kind of went through some payment plans and
Mhm.
other things, and no, I think it's a great project, and we should, if we want to do this, we should do it in form of a resolution. We've had one drawn up for us by Rick.
You have, and there's a gigantic typographical error at the top that I just noticed, so I'm going to have one that I'd rather you sign here momentarily, and my secretary brings that in here.
Oh,
But I did draft that, and I think that the one item that I did change, but I sent that to you, is that I'm just going with the 5-year plan rather than 7. Because
Right.
after we talked,
Yep.
it sounds like it's very fundable and payable in 5. So that was really the only change I made based on the letter that I also kind of redrafted. And in that letter, I just asked for some proof to the supervisors that the loan has been made from the revolving loan fund from Iowa Falls to the organization. And then once that's done, then you're in a position to start making the payments to them, and then they'll add the interest and do the repayment.
Okay.
And we have no issue with that. I'd
39.6.
Yeah,
probably
39.6.
provide copies of the invoices, checks that have been issued, just so you have enough paper trail. If the county would approve it this morning, our next steps would be to go before the revolving loan committee, gain their approval, and then go before the city council March 2nd for their approval. So we've still got some hoops to jump through. That would be our intent.
I'll make a motion for the resolution to approve the $39,600 grant from the lost fund to the Iowa Falls Area Development Corporation.
And I'll second it.
It's been moved and seconded. Any discussion? Again, I think it's a great deal. It's very well laid out. I know you've been working on it for years, and
Yeah.
I think it's a great opportunity for the county as well as the city. Any other discussion?
Thanks, Cindy.
Well, we really appreciate your support. We couldn't do it without you. So.
Hearing no other, roll call.
Ron?
Aye.
Renee?
Aye.
Lance?
Aye. Motion carries.
Thank you.
Next we have is the recorder's imaging system. Hi, Lori.
Hi. I just wanted to bring you guys up to date on our imaging system issues that we've had. Obviously, you know that the former recorder has signed a contract with Solutions for a new imaging system through them. Right now, we're on Image Tech using paperclip. And we had the chance now, since I've been in office, to actually view both programs. And we definitely like what we're seeing with Image Tech. And that's the way we would like to move forward. And we certainly appreciate Solutions' time and effort they put into, getting us aware of their product. But we've been using Image Tech for probably 10 years at least. And we like what's coming out with the new updates, and it's going to be very integrated with the other offices. And the prices, the cost, between Solutions and Image Tech is just like no other. Image Tech is coming in at $2,750 with new updates, and that includes every office that uses Image Tech. And Solutions was going to cost us at the end about $15,000 to go with their system. So it's a cost savings for sure, and that was a major factor in our decision. One thing I'm going to have to do that the former recorder didn't do was do an amendment to the budget to include these costs and the costs for going to Iowa Land Records and being live with e-submissions, with electronic submissions. And that's going to be about $10,655. But that's plus, because we're going to be live with Iowa Land Records in approximately 2 weeks. Solutions has talked to Matt, our IT fella, and they're in the process. I like your smile. Okay, anyway, people are happy. We've heard positive input that they can't wait to do their electronic searching online, so that's a plus. I think that's all I have. Actually, with Iowa Land Records, they did, since Hamilton County and Hardin County are the last ones to be on board with Iowa Land Records, they had to go back and come up with an amount to bring us, say, up to date through June 15th, through June 30th of this year. And they came up with $4,700 that it would cost for both counties. They made the same agreement with both counties that it's going to cost to bring us live up to this point in time. And then there's going to be a cost of about $3,000 per year after that for the maintenance. So, do you have any questions?
I have a comment. Regarding the amendment, I was made aware of it, I just didn't do an amendment before. We're doing it in April, so.
Okay.
I was aware of it, it wasn't a surprise to me, so.
Okay.
Barb spoke to
Oh.
me before she left about that, so.
Okay. I forgot this point. I did talk to Rick and got his help with the termination of the contract. There was a $2,500 license fee that we won't have to pay, and a $5,000 conversion fee, which would convert the files from Image Tech to Solutions that we won't have to pay. There was hardware that we will have to keep, but we can use that, so that isn't a loss for us. And I just want to tell Rick I appreciate your kindliness on the response.
Happy to do it. It was kind of I don't know if you looked at the contract, but it was kind of funny wording, but it was something that we were able to use, and we sent the letter, and then he called, and they've been pretty
Yes, they've been very,
accommodating
yes.
in this, and like I say, there is the expense the office is going to have, but I would say the bulk of the equipment is usable. So I really think it was a pretty happy ending on a contract that the county really didn't want. Couldn't really do anything about it, but I think it's been taken care of. So.
Yep. Nope. Thank you.
Good, thanks.
Any other questions for her?
Oh, thanks.
Next is ineligibility homestead and military credits to be disallowed for 2015 payable 16-17.
I'll make a motion to approve the homestead and military credits to be disallowed for 2015 payable 16-17.
I'll second it.
It's been moved and seconded. Any discussion? Hearing none, all in favor say aye.
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 Motion carries. Next, we have two changes statuses in the sheriff's office.
Okay, I will move to approve the change of status for Jackie Michael, which is a resignation. I'll do these separately.
Yep.
Second.
It's been moved and seconded. Any discussion? This is the job that we appointed last week to Carla.
Correct.
Any other discussion? Hearing none, all in favor say aye.
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 Motion carries.
Go ahead, you're on a roll.
And I'll move to approve the change of status for Julie Tweet, dispatcher in the sheriff's office, which was a demotion.
Second.
It's been moved and seconded. Any discussion? Hearing none, all in favor say aye.
Aye.
Motion carries. Utility permits, secondary roads. I have 3.
We need to do those separately too.
Yeah, that's fine.
Okay.
I'll make a motion to approve the permit 21115A, approve the Iowa DOT and Hardin County Utility Permit application by Unite Private Networks LLC.
I'll second it.
It's been moved and seconded. Any discussion? Hearing none, all in favor say aye.
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 Motion carries.
I will move to approve the utility permit application by Unite Private Networks LLC for installation of new underground fiber optic cable.
Second.
It's been moved and seconded. Any discussion? Hearing none, all in favor say aye.
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 Motion carries.
And I will approve the permit 21115C, Iowa DOT Hardin County permit application for Unite Private Network for underground fiber optic cable.
I'll second it.
It's been moved and seconded. Any discussion? Hearing none, all in favor say aye.
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 Motion carries. Any other business? Hearing none, I'll ask for adjournment.
I'll move to adjourn.
I'll second it.
All in favor say aye.
Aye.
Aye. Motion carries. Sorry, Daryl.
That's all right.